Well, it's an incredibly challenging problem that we're facing. Our Attorney General, Brad Schimmel, he's been a great leader in this as well. And he made a great point, which is as challenging as these issues are, the good news here in Wisconsin is we're leading the country. We're one of the leading states when it comes to a full-scale, comprehensive approach to both prescription drug abuse and to heroin abuse. And I hope we'll be one of the leaders for many years to come.
Scope in Wisconsin is like in any other state. It's enormous and it's deadly. In 2009, opioid deaths exceeded those of car crashes in the state of Wisconsin. We have to find ways to solve this problem so families do not have to face the devastating effects of opioid deaths. At the Department of Health Services, we are implementing a new state law, and at the direction of Governor Walker, Dr. Jonathan Myman has signed an order that will allow all pharmacies in Wisconsin to dispense a life-saving medication that will reverse the effects of opioid overdoses. Dr. Myman's order will allow Wisconsin pharmacists to dispense naloxone without an individual prescription order from a physician to any citizen of Wisconsin.
Naloxone is a medication that quickly and temporarily reverses the effects of opioids. Naloxone is really for anybody who's at risk of having an overdose, whether that's from a prescription pain medication or from something obtained off the street like heroin. So naloxone can be given to anybody at risk, and that includes people who have previously had an overdose, people who are prescribed high doses of opioids, or people with a substance use disorder.
We're excited that the statewide standing order for naloxone will open up access to naloxone, and pharmacists will be able to determine which patients are clinically appropriate to receive the medication or can provide the medication to those loved ones that are requesting it.
Naloxone is administered in two main ways, either through the nose, intranasally, or via an injection. Naloxone kits come with 2 doses. The reason being that sometimes the first dose is not enough to restore people's breathing. In that case, the second dose can be given, buying time for emergency medical services to arrive and give care.
We recommend that pharmacies develop a screening process that would perhaps engage their pharmacy technicians to identify those patients that would benefit from having naloxone on hand.
Even if someone doesn't meet the criteria on the checklist, the naloxone will still be available to them. They should be screened every time that someone comes in and gets a prescription for an opioid. If they meet the requirements on the checklist, they should be at least offered or talked to about the potential of using naloxone. It's important that when we dispense naloxone that we provide patient education as well as information to take home to refer to, because some of these people won't actually be the one that uses the naloxone. It may be available at home and someone else in the household may have to use it.
Once a patient's identified through screening, the pharmacy can create an order just like they would any other prescription and dispense naloxone and provide appropriate training.
Naloxone is very safe. It's been in use for over 40 years and has a very good safety track record. So naloxone has been approved by the FDA and is recommended by the World Health Organization as a tool in fighting the opioid epidemic.
I think it's important to understand that this treatment is for patients who are being exposed to overdose, and that if anything it should be comforting to both caregivers and families to know that they have something in their presence that they can use to help save a life.
Naloxone is an effective harm reduction strategy to battle the opioid epidemic, and there's no evidence that it promotes or encourages drug use.
So there are still some reimbursement barriers to the coverage of naloxone, but some insurers have taken the first steps to address the reimbursement barriers and improve access for naloxone. ESW has had a long-standing working relationship with the Pharmacy Examining Board and the Department of Health Services, and projects like this one really amplify the benefit of collaborating with other groups. We applaud the work that both groups are doing. We also see this as a jumping off point for future collaboration.
We at the Pharmacy Examining Board feel this is an opportunity for pharmacists to provide life-saving treatment. We are very accessible to the public and we see patients and caregivers on a regular basis. Providing the access to this life-saving treatment is something we should all get behind. This is an important step to reducing deaths from opioid overdose.
It is not a cure, but it is a tool that we can utilize to help save lives and to prevent the devastating effects of opioid overdose here in Wisconsin. Survey after survey has shown that pharmacists are some of the most trusted members of the healthcare community. Pharmacists understand the problems, and they can help families in Wisconsin avoid the devastating effects of opioid overdoses.